health promotion, and disease prevention. Health promotion activities can help prevent functional decline in the elderly. Scientific evidence supports the fact that functional disability is not caused by aging per se, but results from illnesses and diseases that are related to unhealthy lifestyle decisions. Up to 70% of physical disabilities associated with the aging process result from unhealthy behaviors or lifestyles. Health promotion activities are those activities in which an individual is able to proactively engage in order to advance or improve health. Wellness is the internal and external environment, physical, emotional, mental, and spiritual, social, and cultural states. A wellness perspective is based on the belief that every person has an optimal level of health, independent of his or her situation or functional ability. Even in the presence of chronic illness or multiple disabilities, or while dying, movement toward higher wellness is possible. As basic needs are met, such as air, fluids, nutrition, hygiene, elimination, activity, and skin integrity, in addition to comfort or relief from suffering, higher levels of wellness are possible. If you look at Maslow's hierarchy framework in Figure 1.5, it's the responsibility of the nurse to assist the client to achieve the highest level of wellness in relation to whatever situation exists. We also look at the holistic approach to health. Health in later life is thought of in terms of functional ability rather than the absence of disease, or also known as the ability to do what is important to a given person. Stress overload diminishes one's ability to cope effectively. Coping strategies that were once effective may no longer work. Depression symptoms can be more somatic complaints, such as physical symptoms of insomnia, loss of appetite and weight loss, memory problems, or chronic pain. You may see constant complaining and criticism, or preoccupation with death or giving up attitude. It may be an early presentation of dementia. All of these causes of death have measures that could reduce the frequency, delay disability, and prematurity of death. What are healthy people? What are its goals? The Healthy People 2020 fact sheet has been provided to you in your resource section. The goals of Healthy People 2020 focus on increasing health promotion programs and decreasing morbidity and mortality related to various disease states. There are 7 essential elements in health promotion and disease prevention that you need to be familiar with. Preventive measures include regular exercise, weight reduction if the client is overweight, eating a low-fat, well-balanced diet, routine dental examinations, smoking cessation, and immunizations. Guidelines for immunizations are ever-changing, and it's best to go to the CDC website for the most current recommendations. Note that there may be modifications and/or additions based on the client's risk status. Looking at safety concerns in the older adult, we have to look at fall and fall risk reduction, measures to promote safety without the use of restraints, aids and interventions for those with mobility impairments, and assisted technologies to enhance self-care, safety, and independence. Many causes of death by injury exist for older adults. Some causes are motor vehicle accidents, falls, suffocation, fires, and poisoning. Excuse me. Normal age-related changes and increased incidence of illness, decrease in muscle strength and reaction time leave older adults more vulnerable to environmental hazards. They have a decreased sensory acuity and impaired balance that may further diminish the older person's ability to respond. Many safety risks are identified in the home. Falls are the leading cause of injury related to deaths and the most common cause of non-fatal injuries and hospital admission for trauma in the older adult. It results in physical and psychosocial consequences. Falls are a symptom of a problem, and so the cause of the fall has to be determined so the problem in the older adult can be addressed. A fall is rarely benign in the elderly. It's usually due to an interaction between an environmental factor, such as a wet floor, and an intrinsic factor, such as limited vision, cognitive impairment, or gait problems. It can indicate neurological, sensory, cardiac, cognitive, medication, or musculoskeletal problems, or even an impending illness. Institutional causes can be limited staffing, lack of toileting programs, restraint use, side rail use, and incomplete assessments. Major causes can be disturbances in visual acuity, cognitive impairment, postural hypotension, cardiac arrhythmias, uncontrolled diabetes, depressive symptoms, lower extremity weakness, gait disturbances, especially observed in clients older than 85. They may have underlying pathological conditions such as arthritis, diabetes, dementia, Parkinson's, stroke, alcoholism, or a vitamin D deficiency. Maybe they use 4 or more prescription medications. And foot deformities, such as corns, bunions, and overgrown toenails, can contribute. And this does include ill-fitting footwear. We start off with assessments using the Morse Fall Scale, or the Hendrick 2 Fall Risk Model, or the minimum data set. We also look at the post-fall assessment, which assesses why the fall occurred to begin with. Review assessment data. Was there anything missed? Exercise is another intervention. Gait training and balance training can be used or should be included in the exercise regimen. Environmental modifications. These will assist along with other interventions to decrease risk, such as lighting or grab bars, etc. A review of medications. Reduction of medications if possible, as medications are an important component of effective fall-reducing programs. And limiting the use of over-the-counter and herbals. Only use those that are absolutely essential. Behavior and educational programs. Educate on the causes and the risk factor for falls. Make sure they have proper education with assistive devices, using low-heeled and non-skid shoes. The cane should be placed firmly on the ground prior to taking a step. When going up the stairs, for example, going up with the good and down with the bad. Restraints can include physical, and that also includes side rails, chemical restraints. All of these can exacerbate the problem, and they are associated with a higher mortality rate, injurious falls, nosocomial infections, incontinence, contractures, pressure ulcers, agitation, and depression. Restraint-free care is the standard of practice, and it's an indicator of quality care in all healthcare settings. So these are just a few ideas on how to improve home safety. Are there any other ideas that you can think of? Well, how about non-skid mats in the bathtub? Dishes and cooking devices that are placed at reasonable heights. Furniture that's easy to get in and out of. Handrails and stairways. Making sure carpet is tacked down. and cords that are secured. We also need to look at environmental temperatures. Contributors to hyperthermia in the older adult include dehydration, exertion during the heat of the day, no fan or air conditioning access, no hat or inappropriate clothing, medications, and alcohol. Contributors to hypothermia include alcohol, aging, setting the thermostat low in cold weather to save money, the client is too thin or they're malnourished, poverty, living alone, nocturia, and orthostatic hypotension. With natural disasters, the elderly are less able to respond appropriately to impending dangers due to limited mobility. The elderly are the highest casualty rate with natural disasters. In transportation, the older adult may have impaired vision and hearing that can affect driving safety, or impaired cognition that can affect driving safety. They may have medical illnesses or functional impairments that may affect driving safety. Comorbidities can be multiple disease states of the individual. For example, they may have related comorbidities such as hypertension, CVA, insulin-dependent diabetes mellitus, hypertension, and peripheral vascular disease. Non-related would be an ulcerative colitis and breast cancer. Holistic interrelationships. How do you see these affecting health? Well, for example, an 85-year-old MI patient says, "I can't get my strength back." So how would that situation affect the person biologically, psychologically, or socially, etc.? And treatment-related problems. Effective chemotherapy and radiation on a person with cancer, the travel to the facility, the expense, the fatigue, the nausea, the vomiting, etc. Or side effects of blood pressure medications. Age-related loss of physiological reserve and chronic illnesses contribute to increased susceptibility to disease. Add to that the number of medication-resistant infections, and older adults are at a higher risk to succumb to an infectious disease than any other population. Effects of influenza and pneumonia can be significant and can lead to numerous illnesses, hospitalizations, and deaths. This equals high cost in health care. More than 1/2 of pneumonia cases were not immunized. A special note, CDC recommends that all healthcare providers be immunized. Many facilities are now making immunizations mandatory. Tuberculosis is on the rise. Cases are highest in people that are 65 years and older. Nursing homes will have the highest numbers due to the close proximity and the clients being at a higher risk. There are specific guidelines for TB testing upon admission to long-term care facilities, and routine follow-up is advised. HIV and AIDS does not overlook long-term care residents. Substance abuse often arises in older adults as a coping mechanism to deal with loss, anxiety, depression, or boredom. Alcohol and prescription medications are more commonly abused than other illicit drugs among the older adult population. The most common type of substance abuse disorder is heavy drinking. Alcohol-related problems often go untreated in the older adult because it's unrecognized. This may in part be due to the fact that the criteria for abuse does not adequately describe the consequences of alcohol use in the older adult as it does for the young and middle-aged adults. It is easier for the older adult to hide their drinking, as especially if they are retired and live alone, because they don't experience the usual social and work-related issues that younger adults do. What type of prescription medications are older adults most likely to abuse? Well, in the female, it's going to be benzodiazepines and barbiturates, and then also opiates. With any addiction, while abstinence is the goal, focusing education on alcohol reduction and reducing harm is also appropriate. Noncompliance leads to significant morbidity and mortality among the elderly. What things lead to noncompliance of an adult? Well, here's some ways to improve medication compliance. Explain the purpose and adverse effects and dosage of each medication. Provide the medication schedule in writing. Encourage the use of standard containers without safety lids. Suggest the use of multiple dose medication dispenser to help the patient adhere to the medication schedule. Destroy or remove old, unused medications. Encourage the patient to inform the primary health care provider about the use of over-the-counter medication and herbal agents, alcohol, and recreational drugs. Encourage the patient to keep a list of all medications, including over-the-counter and herbal medications, in his or her purse or wallet to share with the primary care provider at each visit or in case of an emergency. Review the medication schedule periodically and update it as necessary. Recommend using one supplier of prescriptions, as pharmacies frequently track patients and they are likely to notice a prescription problem such as a duplication or contraindications in the medication regimen. If the patient's competence is doubtful, identify a reliable family member or friend who might monitor the patient for compliance. So these are the reasons for noncompliance. What do you see as the primary factor? And how do these factors influence food intake? These are interventions to help promote compliance. So again, what can you as a nurse initiate? So again, these are reasons for noncompliance with medications. I've just gone over the list of ways to improve compliance. And noncompliance with lifestyle. This is when a client does not comply with lifestyle changes directed by a healthcare provider.